जी डॉक्टर साहब, योर लाइफ.
uh, obstructive jaundice and presented with distal CVD stricture. And he's already got a stent. She's already got a stent in. Can you hear me?
Yes, we can hear you.
She's already got a stent in, and we are doing it to evaluate what's
We
going
can
on
see
in
your
the.
face, but we can see the screen.
You can't see the screen.
Yes, that's right. Yes, now we can see the screen.
Okay. So we identified the aorta. We identified. अब थोड़ा सा आप आगे जाएं. We have identified the kidney. We've identified the spleen, the pancreas, the distal pancreas, and body also is mostly atrophic.
ये क्या है? ये portal
This is a venous system. So I think this has to be portal system.
हाँ,
Yeah.
portal system दोनों उसमें आ रहे हैं.
Yes.
एक सेकंड मुझे दिखाएं जरा, मैं एक चीज़ देखूं. पैंक्रियाज इसमें बिल्कुल ना होने के बराबर है.
These are blood vessels. Yes, liver है ना.
See, there is a pancreatic duct there. Doppler देना. अभी बड़ा अनस्टेबल सा स्टमक है यार. एक सेकंड सर. So we have some lymph nodes. That's the stent there, I think. The two lines there. Yeah. So what I've seen is that there is something that slips us out from the stomach.
Sir,
when
we can
want to-
hardly hear you.
can see the stent
अपना
very
माइक
nicely
एडजस्ट
there.
करेंगे?
But there, Doppler. Yeah, that's the pancreatic duct. So this is the pancreas that we see. Other than that, this is the pancreas there. जी duct वो ऊपर जा रही है. यहाँ से it just doesn't allow me to stay stable. We saw the left kidney and then spleen, but you can see there is no pancreas above it. Khalid, Rayas, can you see it?
Yes, we can see that.
Hello?
Yes, yes, we can see you. And
So
we can hear
there
you.
Really, there is nothing like a distal pancreas here.
That's right.
So we'll go out and see the head, because which is our area of interest. There's a little bit of pancreas just now with the splenic vessels just there.
Now I have to go to the.
Just go on endoscopy, please. You have the option of going full endoscopy, which is not a bad idea, especially in a. बेटा मुझे सारे केसेस की लिस्ट तो दिखा दो यार. तुम लोग केसेस जो तुमने आज दी वो आज के केसेस तो नहीं थे. सो आई नीड टू नो द केसेस नाउ. नेक्स्ट 2 केसेस मुझे ज़रा बताएं क्या है. मैं उनसे पूछ के फिर बताऊँगा.
Here we are.
Yeah, you are in the. So just gentle pull back. Pull back a little bit. Tip up. Tip up. हाँ tip up कर लें अपनी. Tip up. ठीक है. And a little bit anti-clock. लेके आओ. So you've got pancreas there. थोड़ा सा let go of your big wheel. Just tip down करें. Just a little bit. एयर निकाल दो. एयर है यहाँ पे. थोड़ा सा एडवांस करें. So you just थोड़ा सा clockwise करें. You see that's the bile duct there. Those 2 lines are the stent. So
Still करना जरा still. नहीं still करें जरा image को. ये this is bile duct.
you see there,
हाँ.
that's the stent.
That is the stent in the
Now
CVD.
you've got the stent there.
जी.
Now you need to take the air out, and you can follow this, bring it down all the way.
इसके लिए मुझे किस तरफ जाना पड़ेगा?
अब आप clockwise try करो.
ये होगी ये क्या PD है?
जब आप clockwise
नहीं
करो.
नहीं ये PDF जो आ रही थी क्या ये क्या?
PD तो नीचे
ये
नहीं है.
क्या? ये
That's most
वैसा-
likely no.
वैसा-
That's the gastroduodenal artery, I think.
दिखा करें जरा डॉक्टर. हाँ जी ठीक है.
ठीक है,
Off
जैसे
कर दें, off कर
GDA
दें।
हो गया
जी,
मोस्ट
जी।
लाइकली. दैट्स योर पैंक्रियास, दैट्स द पोर्टल वेन देयर. इसको नीचे लेके आना है.
स्टेंट ये
स्टेंट ये आ रहा है.
ठीक है.
ओके, अब आप क्लॉकवाइज करो, थोड़ा सा पुल बैक करो, लेट गो, बिग व्हील को थोड़ा रिलैक्स करो. नो, आप थोड़ा आगे चले गए. वी स्टार्टेड सीइंग राइट किडनी. व्हेनेवर यू स्टार्ट सीइंग द राइट किडनी, दैट मीन्स यू हैव रियली गॉन फर्दर. सो यू कम बैक. या एयर निकाल दे. सक्शन प्लीज. एयर इज आवर एनिमी. Whereas as an endoscopist, you know, we keep putting air. In EUS, you don't want air. You don't really want to see the lumen. So once you've seen where you want to be, then you don't need to do anything. So we've gone further, I think. So thoda sa dekhein, pull back karke. Now you're looking at the liver.
गॉलब्लैडर ठीक है.
Most likely.
हैं
Yeah.
गॉलब्लैडर होगा. ये
लेकिन आप देखें बाहर आ गए मेरे ख्याल में. You're out. So you go back in. And as soon as you enter, don't go too far. Just in the bulb. Yeah. पानी देखना, मेरा बॉटल वहाँ छोड़ गया. पानी कोई भी हो तो दे दो यार, किसी का भी. या ओके, stop. Pick tip up. See, that's the portal vein there.
सही.
Okay. That's portal vein there, right? That's, अगर आप gently देखें, so you can see the stent there. Most likely that should be the bile duct. अब आप एंटी क्लॉक करो जरा. आपने पहले क्लॉक किया था. देखो होता क्या है. So your portal vein is coming down. Just pull back your scope a gentle, just a little, right? Okay, keep coming a little bit. Okay, now clockwise. एयर ना डालें आप.
मैं नहीं डाल रहा, मैं उस पर कर रहा हूँ. वो खुद जैसे मैं हाथ हटाता हूँ वो जाती है ना. मैं तो उसको कर ही नहीं रहा. एयर पे तो हाथ ही नहीं
ठीक है.
लगा.
ओके,
उसको कर रहा हूँ. लेकिन ये देखिए ना, जैसे
थोड़ा सा एयर आपका तंग कर रहा है. बलून करके उसको डिफ्लेट कर सकते हो. बट मेक श्योर दैट यू आर इन द राइट प्लेस, बिकॉज आई एम नॉट श्योर. दैट्स द पैंक्रियाटिक डक्ट. अब 1 मिनट दिखाएं आप, क्योंकि
ये पैंक्रियास नहीं है.
टू मूव. ये पैंक्रियाटिक डक्ट है. डॉपलर दिखाना. Yeah, that's the pancreatic duct. Okay.
सर इसके कर्सर के साथ मार्क करके बताएंगे कि कौन सी पैंक्रियाटिक डक्ट.
एक सेकंड में. लेट मी जस्ट गेट इन, बिकॉज वी वर बैक इन द स्टमक. ठीक है. सो दैट्स द पैंक्रियाटिक डक्ट. कर्सर कहाँ है?
मैंने ऑन किया.
There. डॉपलर डालो. Just follow that, just look at that area and we'll show you the pancreatic duct in a second. There. See that?
Yes, we can see that.
Yeah. So that's the portal vein. It's, I don't know if it's dilated really at the head, because I don't think it's more than 4 centimeters. 4 millimeters.
4 millimeters.
Can you just go in a little bit? I've got the stent here. That's the stent there, that's the bile duct, okay? This whole thing is the bile duct. Hatao top, Doppler hatao. Just want the cursor here. See, the bile duct is here. That's the bile duct.
Sir,
Can you see that?
what are your comments about the CVD wall?
That's what I'm saying. You look at this bile duct here. We're just going to try and follow it distally. So to me this is, see that's the bile duct there. We're now going to go up a little bit. Follow it towards the ampulla. And to me this area here where my cursor is doesn't look normal at all. This is the duodenum here, but this distal CVD, the wall is thickened, this is hypoechoic, and here I feel there may just be a, it's very thick wall. So to me, Khalid and Riyas, this whole area.
Yes, this whole area is abnormal.
Okay, so what I would do is I would obviously take samples from here. I think this patient history-wise also looks to me like as if she's got cholangio, distal cholangioCA. There's one lymph node here. So I'm going to try and see if I can go into the. So now, what I wanted you to see is if we go, I advance the scope and go clockwise. I'm going towards the. So I'm going to pull back. Okay, I'm pulling back a little bit, following the CBD towards the liver. And we should see the stent a little better, hopefully in a second. There, you can see the stent, and this is going further up into the, you see it as far as it goes, and I think that's as far as it goes really. Okay, and if we follow it down this side, we are now, I'm letting the tip down a little bit, pulling back, and yeah, I'm still in the bulb. So you can see the stent there, and just following the stent towards the, that's the duodenal fall off here. कहाँ गया यार cursor किधर? Where's the cursor?
ये बिल्कुल bottom पे.
ये देख रहे हैं आप जो thick wall है, that's the duodenal fall off. See, that's the duodenal.
Yes, we can
fall
see
off.
that.
That's
Yes.
the duodenum here, and this whole distal CBD is obviously not normal.
It is quite thickened.
Okay. There are some lymph nodes, but they are not of interest. So I'll ask Dr. Kashif.
Sir, there is a comment from the audience that is the wall of the pancreatic duct also thickened?
Marginally.
Okay, what is the exact size of?
I'll
PD
tell you
in
what the
head?
pancreatic duct is. I don't think pancreatic duct is more than 4 mm.
So what is the exact size? Did you measure that?
No, I will tell you. I'll measure it for you. To be honest, I don't think that was that abnormal. So I didn't pay much attention. To me, the focus is my focus is more on the CBD really. आगे जाए अंदर जैसे आप ERCP करते. So get me endoscopic view please. Slowly, yes. बस इसमें यहाँ लॉक कर लें अगर आप लॉक करते हैं नॉर्मली हल्की सी जैसे आप जेंटली करते हैं उसको करते हैं बिल्कुल. ओके सो वी गॉट द स्टेंट एंडोस्कोपिक राइट. एयर निकाल दें एंड लेट्स गेट द. हाँ तो टिप अप करते हैं ज़रा सी. सो वी हैव IVC स्ट्रेट अवे देयर. चलें थोड़ा सा टिप अप करें और टिप अप करके. हाँ अब इस वाले में तो बिल्कुल ही ज़रूरी है कि आप स्ट्रेट हो. दैट्स योर IVC देयर. दैट्स IVC. ओके गो एंटी क्लॉक मोर. वी शुड हैव द किडनी हेयर. जाते रहें. दैट्स द लेफ्ट राइट किडनी देयर. कैन यू सी इट?
Yes, we
So
can see that.
now go back clockwise, gently, slowly. Keep your scope straight. This is yeah. Just keep it as straight as you can. That's your IVC. That's compressible. Keep going. That's aorta. Go back a little bit more. That's your aorta. Now when you see aorta, can you see air here very nicely shown through the stent?
This is IVC or this is aorta? This is IVC.
This is
Compressed.
compressible. This is IVC. This is aorta.
ठीक है.
And notice on this air where I have, you can see air actually coming out, telling you that the stent is patent. Okay, so now we know that. आप वापस aorta पे जाएं. Right.
where is the head of pancreas now?
ठीक है, now this is where you need, this is the area of interest, okay? So you need to bring this area here,
अच्छा,
right? So you keep going and just gently pull back. Just a little pull back. बहुत ज़्यादा हो गया, बहुत ज़्यादा हो गया, बहुत ज़्यादा हो गया. वापस go back to aorta, go back to aorta, go back to aorta. This is IVC, aorta. Now what I'll suggest you do is pull back a little bit. No, pull back a little bit.
without moving.
Yeah, without moving anything for now.
अच्छा अच्छा अच्छा,
ठीक है, that's your uncinate coming. ठीक है,
ये
right now go anti. That's your stent. Stop there. Stop. That's the stent we can see there. This is the duodenum here, this side, and so when you, I don't know if you noticed or not, you could see air bubbles coming that way. So now,
Yes, we can see that.
so now when you, yeah, you can see air again. Pull back a little bit and clockwise. There you have the duct coming. Pull back, pull back, pull back, pull back. That's your CBD. You want to follow it. That's your
Okay,
CBD
yeah,
there. That's
so
the
which-
stent there.
clockwise, anti-clock.
If you can, if you want to go anti-clock, you'll go this way. You go clockwise, you're going to go towards the duodenum.
Okay.
So if you want to go that way, we need to pull back. Let go of your wheel a little bit, tip down, and then pull back a little bit. No, clockwise. Keep your rotation. ये तो ये जब आप टिप अप कर रहे हैं तो टिप डाउन कर रहे हैं तो आपकी पोजीशन ये चीज़ नहीं हिलनेगी ना.
सही.
So that's your stent. We probably fallen back maybe. I think.
I think so.
No, we haven't. That's your uncinate.
अब बाहर आ
Can you see that? Now you want to see the pancreatic duct here ना? एक सेकंड दिखाएं. Okay. अगर आप straight हो गए ना ये, what Khalid was showing, look at this. ठीक है? Okay, I can bring back gently here. That's your stent. Following it that side. That's the bile duct. Below that is the pancreatic duct there. So we'll go a little bit more. There the pancreatic. Can you see the pancreatic duct? Doppler do zara. And unlike that one, this pancreatic duct is going towards the. हाँ ठीक है हटाओ. ये तो CBD हो गई, ये pancreatic duct हो गई. Can you see that picture? That's the pancreatic duct there. Sure, हटाओ. And this is the uncinate. I can't see anything here. You just whole area. We can bring it more, a little bit more into. Yeah, this is pancreas, and you can see that. You can see the stent going through. Yeah, stent going through. And all I'm doing is just basically this movement and nothing else. And we can go back to the aorta. Okay. Bile duct with the stent in. Have a glimpse of pancreatic. I don't think pancreatic duct here is really that nicely visible, but we saw a glimpse of it. It's certainly not dilated. So that's the superior mesenteric vessels coming there, just there. Okay, and so now you have the whole uncinate there. So what Khalid was saying, if you pull that out a little bit, you could actually gently come back into the stomach and be able to see the pancreas here. क्योंकि ये head के बाद ये pancreas is really atrophic beyond. यहाँ नज़र आ रहा है, एक मिनट ठहरो ज़रा, pancreatic duct measure करनी है. ले लो ये, take it there, picture. हटाओ इसको यार. Can you see the pancreatic duct?
Yes, we can.
2.5 at the level of proximal body neck. Chhod do.
Yes.
So I don't think I'm. Are you worried about that duct, Khalid?
Can you show me that again and complete that area?
Yeah, there you saw that. Ek minute picture le lo.
Yeah. It's a little bit prominent. What about going into the neck area? Can you?
मैं वही
follow-
जा रहा था. I was just going to have a look at it, but I
Yeah,
saw it here nicely.
Can you follow that? Because I cannot see the duct in the neck area. It just
Yeah, I
kind
can't
of
see it. It just
disappeared.
stops here.
Does he? I didn't see that here. The history. Any history worrisome?
Yeah, I mean, worrisome in the sense that there is obstructive jaundice, distal CBD stricture, and
Can you go back to the head area one more time?
I'm just thinking about this head area is really big, although the rest of the pancreas is atrophic, but I'll just go back.
Yeah, then let's take one look at the head, because I am leaning towards FNA on there by looking at that area right now at least.
Doppler. So, कौन?
नेक्स्ट अब अपन पैंक्रियाटिक हेड मैश एंड एब्डोमिनल पेन कौन सा करना चाहेंगे?
पेंक्रेटिक हेड में ये एब्डोमिनल पेन ले लो. I can't see the pancreatic duct going. एक मिनट है. यहाँ पे आके I am not sure whether this is. एक मिनट है. डॉपलर देना. डॉपलर देना. Keep it on. You see this. कर्सर किधर है? हटाओ डॉक्टर. कर्सर प्लीज. No, I don't know why the hell is not here.
नहीं वो तो गैस्ट्रोडुओडेनल है.
नहीं, वो तो खैर
खैर
आना चाहिए. You can't see the cursor, but Khalid, can you see that duct here? There are two ductal systems here.
Yeah, can you follow that duct somewhere?
Yeah, I'm just going to. I just wanted. This whole area is very.
And there is what?
You see there.
Where is the stent? There's no stent in that area.
Stent is just above this. Okay, let me show you.
No, what I'm saying is,
Khalid, do you see this duct?
I see that area.
Yeah, that to me is, and I'll show you flow as well. That is the pancreatic duct.
Okay.
Okay, and above that, just above that, here is the CBD.
Okay.
Okay, and
Wasn't
this
there
is
a
all
stent
very, this is all very inflamed area. This whole area, and this, when I follow this PD towards the head,
Where
and
is the stent?
can you see there?
Where is the stent?
I'll show you the stent. Just give me a second.
I don't think that those are the ducts. Hanji, I don't think those are the ducts. वो आ रही है लेकिन जो आप कह रही थी पहले वाली वो duct नहीं. I don't think it is a duct. I think उसमें नहीं है तो stent. हाँ वो कितनी के ऊपर पे इस वाले में नहीं है stent.
You see the stent,
Now we see the stent. No,
Khalid?
it's not that way.
I can't hear you.
Gigi, I see that.
See the stent, if I follow the stent all the way,
Let's
The
follow
stent
that.
stent comes down here, there,
Yes.
okay, and
That stent is up there. It's like a,
see the stent comes down to this ductal thing that joins what I was telling you. We lose the vision here, but I'm not sure why that is. But the
I
stent you
think I
can
see
trace.
that what you are showing now. Like, can you go back a little bit? If you move the big wheel towards you, are you able to see that right there?
You see there are two
Now,
ducts.
rotate a little bit to the left. Keep going, keep going, keep going, keep going. Just
So that looks like a mass here.
yeah, that doesn't look right.
No, but then the whole pancreas looks the same color.
And he had a jaundice, or he?
She had jaundice, ductal dilatation, stent in position. She's otherwise a healthy. She doesn't look like someone who's got. What I was thinking was, although the entire pancreas is not enlarged, but could this be autoimmune?
Yeah, that's another possibility. And
But CA199 is normal. So we could biopsy this area.
so it can autoimmune can look like this in this area, but the duct, pancreatic duct, would not be that prominent. That
Yeah,
big.
pancreatic duct, you can see. If I
Yeah,
follow this
that's,
up,
that doesn't make
you
sense.
have two systems here. This is coming down literally here. And I can follow it all the way to the.
So that's is that that air in the stent?
Yes,
So stent is kind of you losing there, but
Yeah.
it is somewhere in the background.
yeah, it is somewhere in the background. No matter I've tried whatever options.
Yeah, I see that now, and I think you need to do a FNA of this area.
Now the question I had was, the walls are very thickened, and this area also doesn't look good.
Yeah.
So I'm not. What I wasn't sure was whether you go in and do FNA on this area here.
It
Which
could
we
be
saw.
autoimmune, really. Sometime with the obstructive pattern in a later stage, the duct can get dilated too.
She's female.
And,
She's
so
good.
could be. I think this is the area you need
This
to
is
do
where I want
FNA.
to do the biopsy.
Yes, I would do
I'll
a
do
FNA
FNA.
of that. That doesn't matter. Actually, if you are suspecting autoimmune, you should do FNB to give you a better, and you can do the staining.
G.
Majority of it is in
Khalid, ये बताएं,
GG.
what is your preferred needle?
So it really depends. Majority of it depends on what the hospital has a contract with. So that becomes the favorite
No, I
needle.
mean in terms of size, do you go for in autoimmune? Do you have any
22,
spec-
a possible 22 core needle. The one you have, I think you have acquired.
Yeah.
I see that. And there is a, by the way, a gastroduodenal in
Yeah,
the
I can
base.
see it. I can see that.
And so we need to, when, especially with the core needle, try to avoid the gastroduodenal. And I think it's okay usually, even if you get through that, but don't keep going back and forth through the same. Once it's forgiving, and artery usually is forgiving as compared to vein, because artery can spasm and bleeding can stop. बिल्कुल बिल्कुल जी बिल्कुल no they do not look like
Doppler though. Yeah, that's my Doppler. This is not a vessel. दिखाओ. No. Doppler दिखाओ. एक दफा Doppler दिखा दो.
क्योंकि चलता है और दूसरा ये कि रोडिक टाइप ऑफ कोलेंजियो ठीक है देयर इज वो जो है नॉड्यूलर टाइप ऑफ कोलेंजियो एंड देन देयर इज अ मैप टाइप ऑफ कोलेंजियो एंड ओके आफ्टर दिस स्पेशली you're in line with
Okay.
pretty much dead. Even if it's hard, when even we look at the outside, it's fine from inside. But you have an idea, like it doesn't look like a normal program. More like an atroffic look.
So I do exactly what Khalid was doing, trying to change, going
With
a
the
little bit
F&B
slowly.
needle, once you start doing those enough, you get this feel. You know the tissue is coming into the needle. It's like a very like a subtle.
And the thing
cracking
is that
sound.
when you can't see the needle,
I mean feel.
it's the shoulder movement, Kashif. So the needle is gone, and I'm only going to move my shoulder here, and needle is back here. Okay, and it's in view. So if you lose the needle, you just need to go back.
Elevator at the last result.
You know, you just move your shoulder, and you should be able to see the needle. One more, and then we are done.
First we have to so first thing is like how to see if
You can see the stent so well up to here.
or move the wheel.
See there?
That's the easiest.
There.
बाद ये है कि अगर आपने elevator
And it's not migrated inside because we saw the stent outside. Just tempted to take specimen from here. Yeah.
that one I really do you think you're pushing
मुझे I don't know what Khalid feels, but
वो भूल जाएंगे वो निशानी है पर
you see, now you can see it a little better. You see the stent all the way. You can see, you can't see the walls, but you can see it making a. I'm very tempted to do an FNA here as well. Khalid,
G
I'm very tempted to do something in this area. I don't know. I feel FNA.
I think it's not a bad idea because
FNA in this
that's
area,
where
I
the
think-
stricture is.
Yeah, I think this area doesn't look good at all to me.
उधर से
What do you think, Khalid?
Gee, I think that's not a bad idea because that's where the stricture is.
So yeah, this
and
is
it's
this
a
is this.
safe area to do it because the stent is already in there. So
Yeah.
there's no risk of bile leak there.
Yeah.
Eh. So I think it's a good idea to go after that at
FNA?
least once. And you may hit the stent, which is okay. You can move it around.
इधर हाथ पकड़े हाथ पीछे करो।
So in this one I would use FNA. What would you do?
G?
इसमें तो मैं FNA ही करूँगा. I don't know.
You can you have a same needle. Just use the same. That's
Same?
fine.
Okay, चलो.
हाँ. आप अमीर लोग हैं लेकिन इसका I think हम
No, I feel that it's just so.
it's a small. I get your point, but
it's
I
a
think you can
smallish
use the
thing,
same.
but anyway, चलो I'll try.
हाँ जी.
वही वाली दे दो जो अभी जो यूज की थी. क्या आया सैंपल? नहीं कुछ सैंपल कितना ठीक आ गया? अबे यार. So make sure you take this rubber thing out because you can't fit the biopsy needle or FNE needle. अच्छा ये अलग बॉटल में डालना है डॉपलर प्लीज रेडी हटा दो You know, when you do FNA or on these kind of thing, you, especially thickened wall, you feel a little resistance area as you're coming out, and that I think is tells us that we may have got some good tissue here. So yeah, I want to stick to this area.
This is what you, when you hit the stent, that's what happens.
But I'm actually when you hit the stent, the feel is slightly different. But when you're coming out with through the wall, sometimes you can feel that. Did you see that the wall was kind of pulled along with this? मुझे एक जरा इसमें वो दे दो सेक्शन दो.
चले अगर आपने FNA यूज करनी है ठीक है आप वो कर लें हमें ना
That's it.
This is my area. Exactly.
That's नसीम को बोलो कि मुझे ये second bottle. So you might have to take one more sample from here. Just 1 second. दिखाओ यार उसका फर्स्ट वाली बॉटल का सैंपल दिखाओ. कितना है यार? We got a 1.5 centimeter tissue here. That should be enough. Kashif? That's quite decent here. नहीं? I don't think we need any more. नहीं बस मेरे ख्याल में तो बहुत है यार. हाँ, that should be enough. I don't think we need to do it. खालिद से पूछ लेता हूँ मैं. खालिद
जी
we've got a 2 centimeter core in the first sample,
जी
which I think should be good enough.
yeah I think so.
So we are done as far as hair is FN biopsies are concerned. The second one I'm waiting. Can you see the stent now all the way here?
Yeah.
But
okay.
you just do I don't know why, but we lose the actual white lines as we come here, probably because
I think it's just a little bit tangential image. It
that's
moves away
probably,
from you. That's what was happening.
That's probably what it is. I've tried different things. I mean, that's the best that I'm getting. So, but this looks a little. But do you get atrophic distal pancreas in autoimmune?
No, you don't.
That's what my concern was.
Yeah.
That's what I'm not sure.
One thing is if you have a stricture, which can happen with the autoimmune, and but usually that has to stay there for longer time, and then you can develop some atrophy.
Again, we have some lymph nodes here which are different to the lymph nodes we saw before. Now you can play with this. So now अब आप straight रखेंगे, and when you go clockwise, your stent is going up. When you go anti-clockwise, you're going towards the duodenum. That's all you're doing. ठीक है, tip up कर लें थोड़ी सी, just a little bit. So you can follow this stent now. If you want to follow that side, you need to just go a little bit more in and follow your stent where it is. There, we're pulling back, we're following it. We're pulling back, we're following it. We're following it towards the liver. Okay, just lost it. Tip up करें. That's it. Pulling back, and with that's the liver there. So we've literally almost gone. You can see the stent all the way, right? Similarly, we go in a little bit, just a gentle, and now clockwise. Clockwise इसी स्टेंट को फॉलो करते रहें, अंदर डालें थोड़ा स्कोप और क्लॉकवाइज करें और थोड़ा करते जाएं।
क्या देखना चाह रहे हैं?
करते जाएं अब, वी आर जस्ट शोइंग व्हाट ऑप्शन, व्हाट हैपेंस व्हेन यू एक्चुअली डू।
साथ भाई इधर की ये जीबी की वॉल देखिएगा, जीबी की वॉल भी थिक है।
हाँ जी बिल्कुल थिक है।
ये वाले नीचे जो है, हाँ ये
सो गो बैक एंटी क्लॉक नाउ। यहाँ पे एक प्रॉबली गॉल ब्लैडर में एक वो है क्या यार, वेट अ मिनट, थोड़ा सा इसको हल्के से मूव कर। Doesn't have any acoustic shadow, so maybe this is a small
polyp.
Yeah, could be.
Yeah.
So movement देखें ना आप, gentle इसी movement में आप अपने tip up करें ज़रा, tip up, pull
up.
Okay.
ये बात.
So we are back into the stomach.
Yeah.
So come back again. थोड़ा pull back करें. And GB को कह रही ना भाभी, तो let's see the GB. We can probably see it better from the just the entrance. पालोरस के पास जाके सक्शन कर लें। नहीं, आप थोड़ा सा देखें, अपना एंडोस्कोपिक व्यू लाएं। Okay, pull back. अब देख लें, अब just go towards the pylorus. Yeah, hip up. Right. Next, keep going. Let's stop here. अब देखें, हाँ ले आओ, अब रोटेट करें। हाँ कोई बात नहीं, doesn't matter।
हम गॉल ब्लैडर के लिए जाना चाह रहे हैं।
हाँ ठीक है। नेचुरल लेवल
गॉल ब्लैडर कहाँ होना चाहिए?
इसे लेफ्ट पे होना चाहिए और आगे नहीं। ठीक है, हिप आप रखिए भी। अब अगर वो क्लैप्स भी हो सकता है, इतना ज़्यादा ना हो। Is there some fluid there?
वो तो
है ज़रा?
हाँ, उसमें तो फ्लश भी था और वो भी था।
नहीं, इसमें देखेंगे। This is some. That's the gallbladder. मैं थोड़ा सा आगे गया हूँ ना, अभी तो मैं एंट्रो में, पायलोरस में गुजरने अंदर नहीं गया हूँ। आ गया सैंपल, सेल्स हैं। ओके, जस्ट हैव अ लुक, लेट मी क्विकली हैव अ लुक एट दैट सैंपल। देखा आपने सर? हाँ, ओके।
डॉक्टर को दिखा दें सेल का
हाँ, कैसे दिखाओगे?
मैंने वहाँ पे उनके लैपटॉप पे सेव करके हैं, अब अभी 2 बजे मैं भी स्टार्ट करूँ।
तो ये भी दिखा दो। अच्छा खालिद है ना, तो खालिद सेल्स तो बहुत है यार, बट आई डोंट नो इफ दिस इज ऑटोइम्यून और व्हाट। We've got adequate cells there, so the cells तो काफ़ी आ गए।
ये सब मैं बल्ब में हूँ। यहाँ पे आप मुझे बता रहे थे कि जो हेड था वो आपको लाने के लिए, अब दिस इज एओर्टा और
नो दिस इज यहाँ पे तो पोर्टल वेन आएगी।
पोर्टल वेन
अगर आप बिल्कुल हेड में हैं तो
जी हेड में होगा।
दैट्स इसको यहाँ नीचे लेके आए, पुल बैक करें थोड़ा सा ना, थोड़ा सा, और थोड़ा सा स्कोप को टिप अप करें।
तो आप ही है
ओके हटा दो,
डॉक्टर हटा दो ज़रा, ये देखें।
ठीक है, थोड़ा सा स्कोप को अंदर डालें और अंदर डालें। You what do you want to do actually? You want to bring this thing here?
या
Okay, so then if go back to that mass, and now pull back a little bit, and yeah, pull back, pull back, pull back. It's moving towards you, right? Now advance कर दें थोड़ा सा scope को, so it's going away from you. So if you want to bring it here, bring it towards you, right? Now try tip up and anti-clockwise movement. See, anti-clock is taking you towards the liver. Clock will take you towards the duodenum. बट उसके लिए ज़रूरी ये है कि आप पोजीशन सही हो आपकी, और दिस हैज़ टू बी मोर इन सेंटर। मेन चीज़ तो आज के लिए तो ये था कि आपने मेन वो करना था ना, जो किडनी वाला एंड ऑल दैट, सो दैट्स गुड इनफ। इफ यू वांट टू, वी आर बैक इन द स्टमक, सो इफ यू आर ओके विद द स्टमक, तो ये गॉल ब्लैडर यहाँ से नज़र आ गया। There's some sludge in the gallbladder, or but इतना कोई gallbladder में कोई मसला तो नहीं नज़र आया मुझे। डॉक्टर परिया इज रेडियोलॉजिस्ट है ना, तो उनको तो
साथ में वॉल इसकी थिक है और स्लज है।
हाँ स्लज है
मसला
बिल्कुल।
उसका यही है कि वॉल उसकी थिक है बस।
नहीं वॉल थिक है, लेकिन डू यू थिंक दैट्स एनीथिंग टू डू विद व्हाट द पैथोलॉजी इज?
नहीं, मुझे ये लग रहा था कि ऑटोइम्यून में ना ये साइड फिट हो रही हो, क्योंकि नीचे से भी पूरी थिक आ रही है ना वॉल, उसका म्यूकोसा इंटेक्ट नजर आ रहा है।
जो मेरा मेन मसला था वो मुझे जो द रीजन व्हाई आई वाजंट श्योर इज I haven't seen that many autoimmune, so that's why I asked Khalid. The issue is that the tail of the pancreas here, you have literally you're following it, and here the pancreas starts disappearing.
You're absolutely right. It's completely atrophied.
So that's what made me think whether this could be autoimmune or not. I don't know if that's possible in autoimmune. I haven't seen that. So you've got spleen, kidney, and again, just Khalid was telling you, you don't really have to do much to go one way from spleen to the other way, which is all the way to the neck. Okay.
Yeah, I think you're right. It's like a body and tail, distal body and tail, they are completely atrophied.
Yeah.
So that goes against that.
Yeah. So now you can see the celiac artery again. You can come back and mediastinum quickly. So the way I do it, come to about 35, tip up. You see you see heart there. Okay, that's the left atrium there.
Absolutely.
Okay. And if I turn a little bit more anti-clock, I start seeing the valves there. Okay, so I can see both aortic valve as well as the mitral valve. When I see that, all you do is you pull back a little bit, pull back, and look at my hand. I'm rotating gently, and that's the aorta. That's the left atrium, and that in between is the subcarinal. Okay. Right, so today what I want you to do is just quickly 35 35 पे आ जाए, ठीक है, सही है ना। अब आप इसको थोड़ा सा जाने दें, स्कोप को नीचे, सिर्फ स्कोप को नीचे जाने। यू गॉट, अब थोड़ा पुल बैक करें, थोड़ा सा क्लॉकवाइज दें, ठीक है, जस्ट जेंटल, बस ज़्यादा ज़्यादा नहीं, हल्का हल्का हल्का। कीप पुलिंग बैक, कीप गोइंग डाउन, so you started seeing the valves, ठीक है। If you go in a little bit, this is your left atrium, that's your pulmonary artery, aorta, and that's your this is the subcarina. So subcarina को देखने के लिए you can always do a little bit of movement here, so you can see the lymph nodes better, the space opens up a little bit, or you go down a little bit more and you can, so you examine that, ठीक है। AP window के लिए what Khalid tells you is that let the scope go down completely, keep pulling back, that's your aorta, coming back right there. Here you just rotate a little bit, go in, tip up करें ज़रा से,
टिप अप है,
थोड़ी सी डाउन करें। So this is the pulmonary artery. दोबारा थोड़ा सा अंदर पुल बैक करें, एक मिनट थोड़ा सा पीछे लाए, इसको रोटेट करें, and you should be able to see there. और थोड़ा जाने,
आगे जाने तो आने
अंदर अंदर जाने थोड़ा सा ना, don't rotate it, just let it go. That is just about where your AP window is. You see there it's separating, आपने देखा यहाँ नज़र आता है, there,
दिस इज
that's your aorta, that's your pulmonary artery, this should be the AP window. So I think this is the easiest way that Khalid teaches, shows, but AP window is really neither here nor there for me. I'm not sure. Okay, thank you. So the जो concept है ना, आपने हमारा मास यहाँ पे, हमने मास को यहाँ लाना है, ठीक है। यू विल हैव टू पुल द स्कोप बैक, मास यहाँ है, हमने इसको यहाँ लाना है, वी विल गो फॉरदर, ठीक है। हमारा मास यहाँ है और हमने इसको यहाँ लेके जाना है, सो यू हैव टू फॉलो इट क्लॉकवाइज। जिस चीज़ को भी आपने अगर आपने इस तरफ देखना है तो आपने एंटी क्लॉकवाइज, सो दैट्स द कॉन्सेप्ट।
लेफ्ट साइड पे जाना एंटी क्लॉकवाइज, राइट साइड पे जाना क्लॉकवाइज जाएंगे आप, और
सोचो हिप हॉप में ये आप इधर चले जाओगे लेफ्ट, ये राइट चले जाओगे, ठीक है। और फुल बैक एंड फुल एंड एडवांस इस तरह से होता है। द ओनली थिंग इफ यू आस्क मी, ये ले लो बेटा, यू आस्क मी व्हाट इज मोस्ट इम्पोर्टेंट टू अंडरस्टैंड। उसके बाद जो सबसे बड़ा